say this indicates that the third wave of the virus has not yet arrived. Well, the South African Health Products Regulatory Authority, SAHPRA, has emphasized that it has not authorized Ivermectin for COVID-19 treatment. Earlier on, SABC News spoke to Budumelo Simezi, the SAHPRA CEO.
From a regulatory perspective, our view still remains to be that there's currently a clinical equipoise position, which means that we have insufficient evidence to say that this product works for the management or as a prophylaxis for COVID-19, but also there is insufficient evidence to say it doesn't work. And hence, in January of this year, we implemented the access control program, and that program continues to stand.
As it stands right now, what is Ivermectin used for?
Sure. So Ivermectin, I mean, as you know, many people know, it's a very old drug utilized mainly for the treatment of tropical diseases. In South Africa, beginning of the year until about a few weeks ago, we didn't have the product registered for human use. It was made available through Act 36 for veterinary use. And we had in our pipeline an application for a product it's a topical formulation, so you apply it on the skin for treatment again of inflammatory skin disease. So again, still very much far from a treatment of COVID-19. It is for the treatment of tropical diseases.
I can imagine yourself and the team are constantly looking at the scientific evidence as it relates to Ivermectin and COVID-19. Perhaps you can take us through where it stands right now and where you are unhappy when it comes to the efficacy of it.
Sure. So yes, indeed, we continue to look for any emerging data on this drug. And also, as we've said, we're encouraging clinical trials so that data can indeed be generated in the country and in other countries. So the latest study we saw was from Colombia, and it was a study of about 400 or so individuals. And again, in that study, they showed that when the patients were put on Ivermectin versus placebo, there was no statistical significant data or clinical outcomes in those two groups. So again, that's the latest piece of data that we have. We continue to monitor. And as we've indicated, our position still remains Ivermectin has not been authorized for the management and the treatment of COVID-19 as we speak. There is a program through which the medical practitioners, once they've done their assessment and their liability and responsibility is squarely with them, they can apply for access through this program, but they also have to report to